doctors in the hospitals have been using ketogenic diets for many, many years to control childhood epilepsy. And it's quite often quite effective in controlling intractable childhood epilepsy. But my experience when I started taking on these patients 2 or 3 years ago was that after they've had about 2 years on the doctor's ketogenic diet, they end up with such severe nutritional deficiencies that it negates the whole thing. I've seen like a 9-year-old boy with osteoporosis so severe that his bones were breaking simply lying in bed. For the last 2 years, we've put him on our version of the diet, and that has improved. So, ketogenic diet is not one form of diet, it's a range of dietary strategies aimed at reducing the intake as carbohydrates and glucose, but maintaining the nutrition. Right? With hemp seed, I mean, you've all tried the hemp seed out there, I hope. I can say without a fear of contradiction that hemp seed is probably nature's most balanced and nutritionally dense food available. Right? From a therapeutic nutritional point of view, nothing really compares to the hemp seed, because not only does it have ample quantities of omega-3 and 6 in the right balance, but it has abundant qualities of vitamin E, which protects that oil from rancidity, and huge, you can look at the analysis yourself, huge quantities of B group vitamins and a suite of minerals, especially magnesium, zinc and manganese, which helps the body actually utilise the omega-3. From our point of view, it's ideal because it has zero carbohydrate. So we can actually create foods from the hemp seed which are entirely nutritional but have zero carbohydrate content. So it opens the way for producing a practical and beneficial ketogenic diet. Now, I've been practicing, I suppose, non-conventional cannabis-based medicine for the last 2 years at a clinic in Newcastle. But in the first 18 months or longer of the practice, most of the people that came to us with cancer especially were at their end stages. They'd already gone and seen the docs, that had either surgery or chemo and radiation, or usually a combination of all of those things. They've been subject to 3 monthly CAT scans. Now remember, the background radiation in this world, we get about 1 millisievert of background radiation per year. One CAT scan will give you 10 times that. If you have 4 CAT scans a year, and often it's a lot more than that, you're getting 40 times, like your whole lifetime's exposure in 1 year on top of your lifetime's exposure, right? And it's very much like throwing kerosene on a fire and hoping it'll go out, right? The doctors know from the study of biology that radiation is carcinogenic, right? They know that one CAT scan, especially a whole body CAT scan, produces at least 10 millisieverts of radiation. But the practice doesn't change. We want to see where the cancer's up to. We'll irradiate it. It really becomes a counterproductive exercise, and that's a situation we're in at the moment. And the patients are then involved in what I call a meat grinder sort of process. You'll go to the doctor, you'll have your operation, you'll have your x-rays, you'll have your deep therapy. The cancer will occur in 9 months. They'll offer you either a stronger drug, and my attitude to that, if they're offering you a stronger drug because they think it'll work, why didn't you get it the first time? But it's just that they go through a series of equally ineffective drugs which damage your immune system, and after a year or 2 of this, they'll look at you and declare you unfixable, and then you'll get a referral to the palliative care, and that's the end of the whole process. I don't know if I spoke last time about everyone is familiar with the placebo effect. A placebo is a Latin word meaning I help. So if a well-intended individual will give someone a tablet, regardless of what its content is, but with the intention of actually helping someone, 20 to 30% of the people will respond in a significantly positive way. That's called the placebo effect, I help. The opposite of the placebo effect is the nocebo effect, which in Latin is I harm. And the same scale of effect is seen negatively. Mum or dad goes into the doctor and says, oh yeah, you've got this, you've had this, I'll give you 3 months to live. right? That sort of negative energy, firstly it's based on no significant understanding of the biology, and it's based on the issue of the patients they've seen before. That's the patients that stay in hospital. Has anyone been in hospital recently? What's the quality of the hospital food? Right? It's unbelievable how poor it is. I've had professors of neurology argue with me in front of a patient that the diet that sick children eat has no impact on their disease. Just let that sink in. These are highly paid, overpaid professors of medicine telling the parents that the diet that they give their children will have no impact on their well-being. It is frightening to hear that sort of thing, especially when they encourage lollies and chocolates and all this basically coloured sugar and rubbish going down. The placebo effect is getting more and more. The oncologists in this country are now using what I call frankly bullying tactics to force people along the path of their treatment. They'll give them figures that they have no idea are true or not. You know, you've got 6 weeks to live if you don't have cancer. And now what I'm seeing is a frightening development following the American model, where if a parent or carer elects to use natural non-chemotherapeutic and non-X-ray modalities on their child, the doctors are now dragging those people into ethics committees, and the ethics committees then, if they so deem it, can take the parent to court and have that parent's control of the child replaced by a court order forcing chemotherapy. And we've seen that in Queensland, and at the moment we're going through this nightmare in West Australia with a 6-year-old boy with a tumour called the medulloblastoma. Now there's a lot of nasty tumours, but medulloblastoma is up there with the very worst of them. It's a tumour of children, although adults can have it too, that involves the posterior part of the brain, or the cerebellum. Worse than that, it very rapidly spreads down into the spinal cord, so once it's out and about, it's a very difficult tumour to control. This little boy had a primary, he presented with headache and vomiting, as a way a lot of them do. Firstly, he was missed by 3 doctors at 2 hospitals. The mother, Dr. Googling, took it to a bigger hospital and said, my kid's got a brain cancer, even though these other 2 said it was normal. The diagnostic quality out there is getting worse and worse too. I'm finding the average well-informed carer has a deeper knowledge of the disease than most of the doctors treating it, but that's another matter. Okay, so this little boy had his primary excision, and then Dr. Walden is his name, Tom, actually approached the parents and said, look, we've got this St. Jude's protocol to treat medulloblastoma, and we're going to give, this is how he puts it, we are going to give Ocean, the little boy's name, radiation and chemotherapy. And the mother was aghast and said, but what sort of results can I expect? I'm not exaggerating. This is the results from St. Jude's protocol. Half the kids won't survive, half the kids. All of the survivors will end up with an IQ reduction to between 70 and 80 IQ points. Right? That's barely functional. The radiation and chemotherapy on an infant's brain is catastrophic. A lot of the survivors of leukemia, we're now seeing them, see, they trumpet the advances that they've made in the survival of childhood leukemia. But when you see these survivors 4 or 5 years later, they're generally stunted in size. Sometimes they're like 50% less of what their expected height is. They're having constant seizures, and they're unable to actually attend normal school and learn in the normal way. And that's what they're actually calling their successes. This mother has challenged the ethics committee at this stage. Now, this is the way it goes. We started our protocol with Ocean, although we haven't fully adapted it. There's some upcatch problems, but we've started it basically. And a period now of 8 weeks have gone. And the deal we did with the ethics committee was that let us have control of this child for the next few months. We'll do what we're doing. Take your MRI, not the CAT scan, the MRI, and if we're holding the situation stable, get out of our way and let us continue. That's exactly what happened. What's that? What's that?
That's right.
All the boys.